new practice in downtown Orlando. And today's topic, I didn't want to just talk about feed, I was talking about diabetes and infection, and we'll talk about feed as well. Oh, I can see it there, I didn't realize. Okay. So there's something in diabetes where people get more infections, and why is that? So one of the things is there's three big things. One of them is blockage of blood vessels, destruction of nerves, and a weakened immune system that happens as a result of diabetes. So we'll talk about the first thing first, which is blocking blood vessels or blocking arteries. And so I'm going to show you this picture. It's a beautiful valley with a river. What happens when you block that river?
Catch more fish.
You catch more fish. But what happens to beyond the block is you have drying grasses and so on. And the same thing happens in our body. So a normal blood vessel, when it gets clogged up with fat and grease and basically high cholesterol, and the walls of the arteries get blocked, it results in certain things. So in the brain, that's what causes a stroke, is that a blockage of the blood vessel. In the heart, it's a heart attack. And this can also happen in the feet. It can happen anywhere where blood vessels are. In the feet, it can cause gangrene. But those are the extreme parts that happen like at the end of, when it gets completely blocked. But there's also something like turning down the tap a little bit. So in coronary artery disease, which is basically narrowing of the blood vessels, and peripheral artery disease, which is narrowing the blood vessels in the feet, it causes chest pain when people exercise. So you don't always get the heart attack, but on the way to the heart attack is your heart actually exercises, needs that blood supply, and doesn't get it. And then in the feet, the same thing happens, is you get pain in the calves and in the legs when walking, and that's all claudication. And those are signs that there's not good circulation going on down there. Blood provides nutrition to cells, and so wounds also don't heal very well when there's blockage of blood vessels. And what happens when wounds don't heal? They get infected. So one other thing why blood is important: when you take a tablet, you have an ulcer in the foot. How does the tablet get to the foot? And so what happens is it gets into the stomach, and the stomach, it gets absorbed into the blood, and then from there it goes into wherever it needs to go. Okay. Additional causes of blood vessel blockages, just like Dr. Kwame had shown, is that high blood pressure, high cholesterol, smoking is a huge risk factor for getting blockages of the blood vessels. And this is in addition to the diabetes, so it just sort of gets worse when you have these conditions along with it. Generally, when people have high sugars, that sugar gets converted into fat in the blood, and so that causes high cholesterol as well. And then if you're eating things that, like Dr. Kwame showed, like McDonald's and well, I probably shouldn't name brands, but if you're eating burgers and fries and things like that, those contain salt, and that salt can also increase blood pressure. High pressure through pipes can cause damage to those pipes. Just like it happens in your house, it can happen also inside your body. So the second thing you touched upon was the nerve damage, which is neuropathy. And why is that important? So if you want to check the temperature of the water, your brain sends a signal to the hand saying, put your hand inside the water to test it. Your hand feels the heat and then tells the brain, oh, this is too hot. And the brain immediately says, pull it out then. And so you take it out. So so feeling pain is actually a beneficial thing. People think that not having pain is a superpower, but it's not, because pain is protective. Because if you don't feel that book burning in his hand, for example, he doesn't know that his hand's on fire. It can get injured. And to put this into more practical sense with someone with diabetes, a pinch in the shoe or a pebble in the shoe, people don't feel it. They stand on it for a long time, and that causes a wound, and that causes damage, and then that damage can get infected. So another thing that happens is an immune system malfunction. Not many people know about this. So
there are different types of blood cells. They all do different work.
I didn't realize I already was talking about that, sorry. So there's different white cells in our body, and they all do different things. So white cells eat up and kill bacteria. There are many kinds. They work in different ways. They send signals to recruit each other, and if there's no blood supply, those white cells are not also getting to that wound, right? So what happens to the immunity when the sugar is high? Well, when the sugar is high, things stop working. So normally when a white blood cell eats a bacteria, it sends a signal to other white cells saying, hey, come and help me, I need to fight this infection. And those signals get blocked when the sugars are high, and they don't work as well, and diabetes is one of the causes for it. Another thing that happens is bacteria go into places where they're not supposed to go, and the body tags them with a spray. Like it's actually molecules. I put a spray to make it more understandable. But it's something called opsonophagocytosis. It's a very complicated word, but that's basically what it is. Okay. And when the sugar is high, the bacteria don't get that molecular coat on them, and so now the white cells are not able to smell out and sniff out these bacteria and go and attack them when they're supposed to. And so why do people get infections in some ways? So one, they cannot feel things, so they get more injuries. They don't have the best nutrition, and the cells don't get nutrition because there's less blood supply to those areas. Less blood supply, so there's fewer white cells. The white cell and the immunity doesn't work very well, and antibiotics don't reach the wound. And so controlling it, you definitely, apart from controlling sugars, you also have to get the blood pressure, cholesterol, and smoking under control. And make sure you see your doctor regularly. If you see Dr. Kwame, make sure you regularly check up with him and check your control your sugars. Taking medicines. If you haven't been to the exercise section, please go, because that's going to help lose weight. Weight loss is the most natural way to improve the immune system and to control sugars. And controlling those sugars is the most natural way of actually protecting yourself and preventing wounds from getting infected. Foot care is very, very, very important in people with diabetes, because a lot of times, unfortunately, people are sometimes not able to see their feet because of their body structure, or they don't pay attention to their feet. And when there's a lot of weight from above, it causes swelling to happen, and so wounds can happen, the nerve damage happens, and people don't realize it's really a recipe for disaster. And very unfortunately, a lot of people with diabetes get amputations. It starts with their toes, and then it goes up to the feet and the leg, and it's very sad, and it's something that can be prevented in a lot of ways. And so this is the most important thing we tell people: if you see a wound, you're diabetic, see somebody immediately. And that's basically my question. I mean, my presentation. Do you have any questions for me? No? Okay. All right. Thank you so much.